All right, guys, when news broke out about United Healthcare CEO Brian Johnson's death, or murder, I should say, social media exploded. And not with condolences, but actually celebration. And I was confused because people are cheering. It's like, wait, someone gets murdered, someone gets shot, and why are we celebrating someone's death? It felt wrong, it felt cruel. It was a bit unsettling. But then the more that I dug into United Healthcare's history, their impact, what they've been doing, it started to make a lot more sense. When a company causes this much pain and suffering, it's obviously not surprising that the public feels zero empathy for its leadership. Now, murder is always wrong. Violence is not the answer. But the way that people feel, I'm not going to say whether it's right or wrong because people feel what they feel. And Brian Johnson, who is leading this evil corporation, and let's be clear here, United Healthcare was and is a very evil corporation. This company that was ruining hundreds of thousands of lives. He's the figurehead. He's the one who represents the organization and is the one calling the shots and leading the organization. So, again, not surprised that the US healthcare system as a whole, and especially United Healthcare, which is even worse than the average insurance company in the US, has led to this level of anger and disillusionment with people, with the American people, with patients. Now, right off the bat, I'm not anti-capitalist. I'm not socialist. All of these systems have issues. I think capitalism is the least bad of these systems. But when you start taking capitalism and this motive for profits towards healthcare, you start getting a lot of issues. So United Healthcare, this megacorp, they don't just make money, they print it. So in 2023, with United Health Group, which is the umbrella company that has the insurance underneath it as a subsidiary, they made $371 billion in revenue, and the insurance component was $281 billion of that. And now in 2024, in just the first 9 months, the group's revenue is $394 billion. That's more than the GDP of many countries. But that begs the question, hey, American company, successful, profitable, if they're clearly crushing it from a financial perspective, why are they so universally hated? So now let's cover the actual United Healthcare business model. First of all, part of the reason they're so profitable is that they deny 1/3 of all claims, 32% of all claims. Now, for context, that's twice the industry average if you look at other health insurance companies in the US. And at the end of 2023, they were actually hit with a lawsuit alleging that they used this flawed AI algorithm to deny medically necessary treatments for elderly patients. And I believe it was also psych patients too. It's probably actually many different groups of patients. I remember shopping for my own insurance, maybe it was a year or two ago, and United Health had the most competitive premiums in terms of pricing. I was like, ooh, maybe I should consider them. But then I heard horror stories, so I'm glad I did not go with them because I would have definitely been denied it. And again, more on that shortly, which actually brings us to the next point. So they love playing, let's call this pharmaceutical roulette. If you're stabilized on a medication for some chronic illness, for me, that's inflammatory bowel disease, ulcerative colitis, Crohn's disease, you might wake up one day and find that you've been switched to a cheaper medication that is less effective. And you may wonder, like, what the hell? Like, I need that other medication. Well, it's because they decided they got a better deal from this other pharmaceutical company, so we're going to switch you to that because it's going to save us money. Your health is just collateral damage. It's not the priority. Case in point, in 2022, there was this college student with ulcerative colitis. Again, same condition that I have. And I think he got sick at 19. I got sick at 18. Very similar. Like I feel for this guy and I can relate to him. And his life-saving treatment was suddenly deemed not medically necessary. Why? Because his account was flagged as high dollar. Translation, too expensive, right? So this poor guy finally got relief after years of suffering with IBD, finally getting on the right medication. And there's a lot of trial and error. Let me tell you, like, the first year and a half was really rough for me as well. And I'm sure it was rough for him. You're trying different medications, trying different diet, different lifestyle. It fucking sucks, guys. So after years of suffering, the guy finally gets relief. And then United Health is like, yeah, JK. And stories like this make my blood boil because I can relate, and it is completely unacceptable that in 2024, we are tolerating this kind of nonsense. Now, the shadiness doesn't end there. So earlier this year, the DOJ launched an antitrust investigation into United Health's acquisition of healthcare providers and data companies. These guys are the epitome of a evil megacorp because even when the government, which can barely agree on the time of day, calls you out, for being greedy, anti-competitive, you know you've gone too far. You know you fucked up. So now with all this in mind, how can you expect the people who are getting fucked over by United Healthcare with their health? Imagine you have a chronic illness, you're debilitated, you're bedridden, only to finally get relief, and then haha, JK, pulled away from you, right? How do you expect those people to have sympathy and empathy towards the CEO who was killed when the reverse isn't happening? If you expect to receive empathy, you need to behave in a way that deserves that and demonstrate some empathy yourself. But clearly, the business practice of United Health is not one that seems to have any empathy. It's the embodiment of corporate coldness. And people are frustrated. And over the decades, over the years, even in recent years with COVID as an example, the wealth gap gets wider and wider. So you have this company that's doing these evil things. And even the CEO, it's not like this guy was a saint. He was in hot water for insider trading. I mean, we're not surprised, right? But going back to this class divide, for those who have followed Ray Dalio, he talks about these big macro cycles and how, the United States, we're like one of the top powers in the world, and no single country is going to maintain that forever. And you look back in history and it goes through these cycles. And it makes you wonder, are we getting to the point where the common people are getting frustrated with the mega rich, the corruption, the complete insanity of some of the things that we're allowing to happen in 2024? And is this hinting at something to come, some breaking point? So let's talk about Americans' experience with health insurance more broadly. The insurance companies in the US, they're masters of bureaucracy. They make healthcare a complete nightmare to navigate. And even if you have good insurance, you're like, hey, I'm going to get the best top of the tier. I'm going to pay these really high monthly premiums, which I do because I have a condition and like getting my medication in a timely manner is so important to maintaining my health and not ending up in the ED. Even with good insurance, you're not necessarily safe. So you spend thousands and thousands of dollars on good health insurance. You then pay thousands and thousands of dollars on top of that to meet your deductible, and then you're still not safe. You can still end up fighting for coverage, begging for medications, or wasting time, spending hours and hours. I've actually had to hire a patient advocacy group. Shout out to Purple Card, right? They were actually really helpful because I was spending so many hours on the phone. I was like, dude, I gotta work. I need to be able to afford these expensive medications and my expensive insurance. And they were able to help me navigate and help do some phone calls for me. And these companies, they couldn't care less. They're like, hey, yeah, you can be on this other medication, which is like similar enough, but it's going to save us a lot of money. And me and my doctor were like, no, I cannot switch medications. This thing has been working for me for 10 fucking years. Why do you want me to switch? And I have a good insurance company, not United Health, right? I have a good one. And even then they were trying to switch me, and we had to go back and forth and fight it. And luckily, in this case, we won. But I'm sure if I was with United, that it would have been denied. So let's be real. No one in America thinks that our health system is great. It's a broken mess where, again, the rich get richer, the poor get poorer, and the average person gets the short end of the stick. So when you go on social media, you see zero empathy, the memes, the snarks, the jokes about this person being murdered. Can you blame them? They're coping. They're powerless. They're frustrated. They're angry. I've actually seen some comments that are pointing out the fact that Brian Johnson, when he gets murdered, he's this high-ranking, powerful guy, wealthy guy that gets so much attention from the media and effort from the police to solve this. And if it was like me or you, no one would give two fucks. And it made me think of Stalin's quote, or I should say, allegedly Stalin's quote, which was, a single death is a tragedy, a million deaths is a statistic. And with United Health's denial of coverage, they have caused a lot of suffering, a lot of deaths, and it's just a statistic. To them, we're all just line items on a spreadsheet. We're just pawns to help them make more profit and give more profit back to the shareholders. And I've seen some other thought-provoking comments about how United Health has also caused violence. I was like, what do you guys mean by that? And they're pointing to the fact that when we think of violence, we think of the bodily injury and harm and death that can be caused by things like guns, right? Obviously, Brian Johnson, the victim of violence, physical violence. But they're pointing out that, United Healthcare has been conducting legal violence. It's not physical, but they're still causing bodily harm, death, etc., through the withdrawal of care, withdrawal of coverage, because people cannot afford it without that. Okay, so how to fix the system? Disclaimer, I'm no expert on how to fix US healthcare. It's very complicated, but I want to talk about some bigger picture ideas, compare the US to other countries, and then let's start a discussion about this. And I'm glad that we're actually getting more attention. It's the silver lining to a tragic story that at least we're all talking about this. Like Anthem, as an example, was, I think it was the day before the murder, they were withdrawing coverage for anesthesia after a certain duration of time. And let me tell you, as someone who has been on both sides, as both a patient undergoing procedures for my inflammatory bowel disease and also an MD that was in plastic surgery residency, there are times when procedures last longer. So you're under or you're sedated, you're being operated on, or you have a procedure being done, and then you wake up to be like, oh yeah, the procedure took an extra 30 minutes because your anatomy was a little bit abnormal in this way, and yeah, now it's gonna cost you an extra $3,000. The fuck is that? Now, when we think of healthcare systems around the world, there are three pillars that you can optimize for. There's cost, there's access, and then there's quality. And when people talk about this, they often think of improving one and maintaining the others, but they're all correlated. You can't change one without the other two being affected. So the US prioritizes quality and innovation, but at the expense of cost and access. So first, let's go over access. Access is how easily and equitably people can access healthcare. Universal coverage systems, like in the UK with the NHS or in Canada, give everyone access, but there are downsides, right? The access is there in the sense that you can get your healthcare services, but the immediacy is not. So in Canada, you can wait 6 months to go see your specialist or get whatever procedure you need done because the availability isn't quite there, the timeliness. With the US, there's perhaps more timeliness for those who do have access to healthcare, but many people don't even have access. That's due to high out-of-pocket costs, that's due to significant health disparities, and so on. The next category is cost, and that's both how much the country overall spends on healthcare and also how much the individual spends. And no surprise, the US tops the list by a significant margin compared to any other country. We're spending about $12,000 per person. That's $4 trillion per year on healthcare. And our GDP per person is about $90,000. So 28 trillion. And I've seen different estimates of 13 to 70% of GDP on healthcare. Countries with single payer systems, like again, Canada and the UK, spend way less per person. And the third and final category is quality. That's the effectiveness, the outcomes, the efficiency of providing healthcare in that country. So the US excels in medical innovation, cutting edge technology, specialized care, stuff like that. But many other countries outperform the US on things like life expectancy and morbidity, you know, having these illnesses like obesity, et cetera, because they have better primary care and preventive measures. And I would also argue just a different culture where it's not like, I want to keep eating my Cheetos and you give me a magic pill and it better work and I don't want to have to do any work. So now that we understand these three categories, the US prioritizes quality and innovation, but at the expense of cost and access. And even that quality is like an asterisk, right? That's more like the medical innovation and cutting edge technology and specialization, but not the lower level of preventive and, you know, medicine 3.0, which I talk about in that other video summarizing Peter Attia's book. Now, the biggest issue, of course, is cost, because that's a lead domino, you could argue, that is causing issues with access, right? And just overall, such a high cost to the country as well. And prices are nonsensical. It's essentially like monopoly money, because there's no proper incentivization, there's no coupling. And when you think about it, with privatization of health insurance and medicine, it's hard to actually align those incentives. And if you keep thinking through it, you're going to probably come to the same conclusion that you need to have a single payer system to keep costs down and align incentives. Because if the average patient is with an insurance company, let's say 3, 4, 5, 6 years before they change companies, you know, where they work, and they go to a different insurance company, then that insurance company is not motivated to optimize that person's health long term. Because hey, in 5, 10 years, sure, they're going to get diabetes. They have pre-diabetes now, but hey, that's not going to be my problem. That's going to be a cost for the next guy, not for me. And as a private company that wants to make money, my incentives and my duty to my shareholders is to maximize profits. Therefore, I'm just going to do the bare minimum and not try to get on top of things right now. But with a single payer system, that patient, you own that patient and their outcomes for life as long as they are living in that country. So now you are incentivized, oh wow, this person has pre-diabetes, I want to get on top of this to make sure they don't get worse and worse metabolic health and then get diabetes and all the terrible downstream effects of that, which is going to cost the healthcare system even more. So let's tackle this now. That's one of the big benefits of aligning incentives. Right now, a bag of normal saline is $150 because it's play money. It's like insurance companies and hospitals just playing this game. The actual patient doesn't have enough skin in the game either. They're paying 6 to 9%. And I'm not saying that we need to be paying more, but we should be paying a larger percentage and the total cost needs to come down. So we should be paying less, but that lesser payment should be a greater proportion of the total cost of healthcare. But things are just inflated and ballooned out of proportion because, again, it's monopoly play money for these guys. We know that medical costs are the leading reason for personal bankruptcy. And I would always think, oh yeah, I mean, those people just need to get good insurance and then that way they'd be covered and you would never have to pay more than a couple $1,000s or, $7,000, whatever your out-of-pocket max for your health insurance policy is, and you'd be fine. But then what you learn is that a lot of these people do actually have insurance, but then their claims are just denied. Oh, you're out of network, or you're this, or you're that, and now you're fucked. Now you got to pay tens of thousands of dollars. You can't. Bankruptcy. It's just wild to think that the US, by certain metrics, but not others, is the richest country in the world. And yet, we don't provide healthcare to all Americans. And I'm not even saying that you need the most cutting edge, expensive, newest tech, but just the standard of care, man. Just give the standard of care. We can afford to do that. We don't need to be padding the pockets of these insurance companies and these investors. Again, I'm all for capitalism, but when it comes to health, there's clearly no place for it. You need more regulation, and in fact, you probably need a single payer system. Again, the murder, it's a tragedy, right? I don't think that murdering someone or violence is ever the answer. But at least we're now discussing this. We have more visibility on this issue that has clearly been bothering and been an issue for millions of Americans, including myself, right? I've been a patient since 2009. I've had this chronic illness, and it's not like I did some stupid shit that then, oh, sucks for you, you deserved it. No, dude, I'm just like a healthy, physically active dude that based on our diet and based on being prescribed way too long of antibiotics by my doctor at the time, I just, higher risk. And it sucks. I'm glad we're having the conversation. We should be demanding for better because we do deserve better.